Good afternoon. Today we will be presenting our presentation on Medical Examiner CSI. My name is Miguel.
My name is Chris.
Our patient is Brandy B. Meyer, and the medical mystery is she thought anxiety and drinking made her ill, but the truth was scarier. Our patient is a mother and a wife.
Her illnesses were Brandy has been struggling with anxiety for the past 4 years. Doctors prescribed her with antidepressants, which were supposed to help, but it was just making her worse. Many doctors will often just prescribe her for more antidepressants and send her home.
Her medical history is her illness first started when she was in her first trimester of pregnancy. She would often feel out of it and shaky, but these symptoms still continued even after she gave birth. For about a year, Brandy had taken 4 different types of medication, to which none were helpful. She was not getting better. She was also suffering from memory loss, which she blamed on her drinking, but even as she stopped drinking, her memory loss still kept getting worse and worse and worse. She would even forget times when she would get rushed to the ER because she would be passed out drunk. She talked about her memory loss to her psychiatrist, who advised her it might be a side effect of her medication, but just told her not to take it if she was going to be driving, and didn't really explain other health risks.
What happened was Brandy was backing out of her driveway when she almost hit the wall. Her husband tried to warn her, but it was as if she was a deer in headlights, frozen. After this, she went to the hospital where they ran a CT scan on her head and revealed that the cause of her symptoms was a peach-sized tumor that was invading both frontal lobes of her brain and was causing both and personality changes and also making her have severe seizures, which determined that the tumor was a rare cancer that attacks both the brain and spinal cord.
The medical terminology for these things is a CT scan is a computed tomography scan, is a medical imaging technique used to obtain detailed internal images of the body. Oligodendroglioma, a rare type of brain cancer, a brain tumor that develops from glial cells called oligodendrocytes. And postpartum depression is this depression suffered by a mother following childbirth, typically arising from the combination of hormonal changes, psychological adjustment to motherhood, and fatigue.
Absent seizures were a type of seizure that involves brief, sudden lapses in attention, panic attack, sudden episode of intense fear or anxiety, and physical symptoms based on the perceived threat rather than imminent danger.
Oligodendroglioma. Eventually, Brandy was diagnosed with oligodendroglioma. It's a rare type of tumor that's developed by glial cells called oligodendrocytes. That's when there's a rapid growth of cells in the brain, and the cause of this disease is not known, but exposure to radiation and certain gene changes that can be passed down can increase the chance of getting this disease.
Symptoms she had were seizures, headaches, and weakness or disability in certain parts of the body.
And these are our sources. We'll give you a second. And that concludes our presentation. Thank you. Have a good day.